Autism, ASD, and ADHD are distinct neurodevelopmental disorders, but they share some overlapping traits, which can lead to confusion. Here are the first 20 key differences between the two, in core definitions. 1. ASD is primarily a social communication disorder with restricted and repetitive behaviors. 2. ADHD is primarily an executive function disorder affecting attention, impulsivity, and hyperactivity in social interaction. 3. ASD. Difficulty understanding social cues, body language, and unwritten social rules. 4. ADHD may interrupt conversations or miss social cues due to impulsivity or inattention, but generally understands social norms. 5. ASD may appear disinterested in socializing or prefer solitary activities. 6. ADHD often seeks social interaction but may struggle with turn-taking or listening. 3. Communication differences. 7. ASD may have delayed speech development or atypical speech patterns, e.g., monotone voice echolalia. 8. ADHD typically has normal speech development but may talk excessively or interrupt others. 9. ASD takes language literally, struggles with sarcasm and idioms. 10. ADHD understands figurative language but may not listen long enough to process it, in repetitive behaviors and special interests. 11. ASD engages in repetitive movements, stimming like hand flapping or rocking. 12. ADHD fidgets for sensory stimulation but not in a stereotypical way. 13. ASD has intense, narrow interests, for example, trains, dinosaurs, specific facts. 14. ADHD jumps between many interests but doesn't dive as deeply, in attention and focus. 15. ASD hyper-focuses on preferred topics but struggles with shifting attention. 16. ADHD struggles to sustain attention on non-preferred tasks but can hyperfocus occasionally. 17. ASD may ignore people speaking to them due to lack of social motivation. 18. ADHD misses instructions due to distractibility, not lack of interest, in sensory sensitivities. 19. ASD often has extreme sensory sensitivities like hates certain textures, sounds, lights. 20. ADHD may have sensory issues but less severe and more related to distraction than discomfort.